Welcome back to Gitanjali Group of Institution. Dear my students, today I am going to discuss the second session, the continuous part of the CPR. For the last video, I have explained regarding what is the meaning of CPR, and I have explained regarding what is the anatomy, physiology of the heart, and I have explained the definition of the CPR. My dear students, so today I am going to explain the continuous part of the continuous things going to happen here. So let us see. Yes, dear students, so here in our session I am going to start with purpose of CPR. As we know that the CPR is nothing but cardiopulmonary resuscitation. As I explained for the previous video, when the heart is going to stop, the functioning of the heart is nothing but cardiac arrest, is nothing but going to be arrest of the heart. So whatever it may be, when it is going to happen, in such a case, as a professional nurse, we must go for this CPR. And in some cases, we must know what is the purpose of CPR, why we are giving. We need to know. Before doing any procedure or before doing any function, make sure that what is the purpose of particular thing. Yes, so going to do the first function is to maintain an airway of the human. Airway, as we know that airway is nothing but nose, nostrils, nasal cavity, bronchus, bronchioles, lungs will called as airway. You know, when the person is taking normal breathing, the airway will be normal. In the sense, when the normal airway, the breathing will be normal. That is what I am trying to say. You know, when there is some obstruction, when there is something distraction here, the airway pattern will be changed. You know, when the airway pattern is going to change, automatically whatever air, whatever the things I am going to take, I can't take properly. When I am not able to take properly, it is going insufficient of the oxygen percentage within the blood. When there is an insufficient of the oxygen percentage within the blood, the heart is thinking what happening. The heart is trying to be act like a normal, but heart can't, because there is a the oxygen percentage is decreasing because of airway obstruction. In that case, make sure that whether the airway is clear or not. In such case, when there is no proper oxygen percentage within the blood, the person will go for unstable, the person will go for unconscious. In that case, if you are giving directly CPR, it is useless. So what I am trying to tell, when the patient is unstable, when the patient is unconscious, the first priority, the first purpose is make sure airway is clear or not. Is it? So for suppose I want to tell an example, you are going on road. You want to reach one destination. You want to reach the place exactly within the time. But there is a road is jammed completely. In that case, you need to check the way. Which way is a jamless? Which way is a suitable to reach immediately to particular location? So that is the thing you must remember here. If you want to give CPR, make sure the way is clear or not. If the way is clear, automatically your CPR will be output. That is the main function of your opening of airway clearance. And second one is to maintain breathing pattern by external ventilation. Let me tell what is the meaning of your ventilation. If the heart is functioning properly, automatically the lungs also will properly work out. If the lungs is working properly, automatically the heart also will be work properly. So here, so when there is a problem for the heart is going to stop. In such cases, you must go for external ventilation. So whatever you are giving, that is called as external. And what is the breathing external ventilation is nothing but mouth to mouth respiration. For suppose we don't know where the person is going to collapse. We don't know exact place where person is going to unstable, where the person is going to unconscious. In such a case, we don't get such a oxygen cylinder. There is no nearby any hospital, nothing is there. In that case, don't wait for the hospital, don't wait for the ambulance. Start the external ventilation is nothing but mouth to mouth respiration or mouth to nose. Such a things I am going to explain. So here next purpose is to maintain blood circulation by the external cardiac massage. Yes, when the heart is stopped. So actually here I want to tell, so heart is built like this. There is a upper two chambers, there is a lower two chambers. So the heart is having capacity. Individually it is going to pumping like this. When the both upper chambers is going to close, automatically the both lower chambers is going to open. So it is a simultaneous process. It is called as conductive system. So conductive system is nothing but heart has the speciality of electrical impulse. So heart has, that is a conductive system is nothing but SA node, AV node is a two nodes are there which are going to generating of the electrical power for pumping of the blood. You know, in our daily things, if the machine want to work, need some electrical supply. Whereas you think once, where is the electrical blood supply? Where is the electrical supply for the this machine heart? Nothing. The God has made our heart with own electrical supply which is created by the conductor system which is there in the heart itself, being as a SA node, AV node. So what is exactly going to happen when there is a disturbing of the conductor system, when there is a problem we are find out in the heart, the pumping of the blood is going to stop. The both atriums, the both ventricles is going to stop. In such a case, when individual is not working, externally you want to give. That is exact meaning of the CPR. So that I am going to explain soon. And next one is to save the life the person. Yes, always being the medical person, we must focus on save the life of the person. Wherever, whatever, whichever, the focus must be in the saving of the patient. And last purpose is to provide basic life support. Is nothing but you must provide the basic, whatever you know. You provide the CPR. Whatever you know, you go for defibrillator. That is nothing but advanced life support is nothing but go for advanced. Go for defibrillator. Soon of the CPR, you just send the hospital. So such things are there. So just stepwise I am going to explain right now. Yeah. So this is actual steps of the CPR. The first one is approach the safety. The second one is check the response. Next, shout for help. Next one is open airway. Next one is check the breathing letter. Next one is call for onatate. And next one is the compressions, nothing but 30 compressions for chest and 2 breathing. So each and every step I am going to explain right now. So before that, I want to tell one thing to you, my dear students. So first one is, the first step is nothing but approach the safety. Dear students, so being a student of the nurse, being a professional nurse, or being normal human, you must remember this first step is very important, safety. Because we don't know where the person is going to collapse. We don't know where the person is going to unconscious. For suppose the person is going to unconscious on road, what you will do? You don't want to give CPR on the road because there is a vehicles, because the road is somewhat hard. It won't work. So in such case, take the patient or take the person at the safe place, where the place is safety. This is the called as approach the safety. If the person is collapsed on rocks, if the person is collapsed on somewhere else, elevated area, unelevated area, some area, so take the person on flat surface, take the person on clear surface, take the person on flat area. That is the meaning of approach safety. Safety is very important before you are going to the CPR. Not only CPR, but also whatever medical procedure you are going to do, the safety is a top priority before going to do any procedure. The second one, after checking of the safety, what is the second step? Check the response. This is the thing you must remember, how you need to go for checking of response. I want to tell one thing, don't think that every person going to unconscious due to the heart attack. So our sir is told that when the person is unconscious, whether the person is unstable, directly I want to give the CPR. Not at all. So nowadays, some of the peoples is going to fall because of zinc deficiency, because of iron deficiency, because of dehydration during the summer season. So because of some other things, the persons will fall. Ladies or gents, whoever, then there is some blood supply is going to something problem, then they are going to fall. That's what I am telling. Go for check the response. When you find someone is unconscious, the checking response must be tap on the shoulder. As I am showing here picture, tap on the shoulder. Of course you don't know who he is. Of course you don't know who she is. Even though, tap on the shoulder and shout loudly, Mr. and shout loudly, Miss, because you don't know the name, and give the respect and call them. Tap on the shoulder, tap on the chest. Definitely, if they are not due to the cardiac arrest, they are going to fall, they will wake up. They will come back. A little water just pour on face, they will come back. Because of dehydration, if they fall, definitely they will come back at the normal position. After checking response, still the person is not getting response. What we supposed to do? Yes, check the response. This is the way we need to go for checking. So shake the shoulders and ask, are you alright? So this is actual English. So whatever your language, you can call them. Are you alright? Are you okay? So like that, you just check the response. And next one is, so before going to tell, my dear students, as I am telling, so there is a Gitanjali Group of Institutions. In that, as I am telling, I used to tell, so we have well infrastructure, well reputed, and which is the approved by INC, which is affiliated with WBNC. So as I am showing here for you, future nurse students, so there is our college is nothing but Sainthia Nursing Institution, which is located at the Sainthia. This is our college infrastructure. So you can see everything here, which is affiliated with WBNC and approved with INC. And one more thing I want to show, that is second college is Rampurhat Nursing Institution, which is located at Krishnanagar, and it is going to already approved with INC and affiliated with WBNC. So these are our well reputed and well organized, well infrastructured college, where we can see in our Gitanjali Group of Institutions. My dear future nurses, please check our page, please see the videos and suggest your juniors to take the admission in our well reputed college. So this is I want to tell. And next we are coming for the topic, and next step is shout for help. For suppose the someone is going to fall on the road, the someone is going to unstable, someone is unconscious, the two steps are completed. You approach the safety, and second one is you check the response, still there is no response, and third one is shout for help. It is a mandatory, because someone is lying there, no response. You are thinking, yes, something is wrong there. You are only one person. It is not possible to give CPR. Yes, you can try, but someone need to call ambulance. Someone need to approach the hospital. You need some more help. In such a case, the third step is shout for help. Shout, come here, Mister, come here. Like that, you can shout for help. That is the third step in our CPR. And next one is, after shouting, then you can go for open the airway. During the purpose, while I am explaining purpose of the CPR, I explain the airway must be clear. So here, when the person is unconscious, when the person is not giving the response, when the person is unstable, in such cases, when the patient is on the flat surface, this is the way you are observing the airway. So this is the method is called as head tilt method. The two methods are there. This is called as head tilt method. So head must be, you must be bent towards the back. This method is called as head chin tilt method. Matlab, so you must be tilt the head as well as chin also. I want to tell one thing. Our human structure is constructed, the pipe is like this. You know, when you want to give proper ventilation, you must be bend it. in order to make as a straight position. When it is going to straight position, then only you can able to give your proper breathing. I want to tell an example. There is a pipe is there. You want to pour some water. If the pipe is straight, then only you can keep the water, then smooth flow will be happen. If the pipe is bent, how much your water you are pouring, that much it is going to stuck. Still the problem will happen. The same thing, our structure is made is like little bent when I am stable. When I am conscious, we must make sure the pipe must be straight in order to make the flow is smoothly. That is the way we must go for open the airway in the position of head tilt and chin lift method. So this is the actual thing. By seeing diagram you can understand. And next one is, after checking that, check the breathing pattern. Yes, so I check this airway. So airway is clear. Okay, clear the way, completed. Next step is go for breathing. Whether the patient is getting breathing. How you can check the breathing status? The first status, the basic thing, see the chest elevations. If the person is the stable, if the person is the normal, every second the chest will be elevate like this. It will expand, it is recoil. It will expand, it is recoil. When you are taking breathing, inhalation, exhalation. When you are taking inhalation, the chest will be expand. Is it? When you are going to expel, the chest will be recoil. There is a simultaneous reactions will be there. This is a normal patient, the normal person, we can observe the breathing pattern. Whereas when the patient is unconscious, we can't able to see the chest elevations and all. Then we can find out that the lungs is not working. The breathing is stopped. Okay, so that is the way you are going to check the breathing pattern. So breathing pattern is checked, the breathing pattern also no more. Then what we need to do? So we need to ready for the CPR, because the airway is clear, the breathing pattern is no more. Then you decided yourself the patient is fall down because of cardiac arrest. In that case, you must think you need to start immediate CPR. As I told you in the last session, it is a golden period. What is the meaning of golden period? When you are checking this all the steps, when you found the person is unconscious, when you are going to follow the all the steps. Dear students, I am telling this many steps you must follow. These are the steps you must follow within the seconds only. Within the seconds you must refer, then go for CPR. Before you are going to start the CPR, call your emergency vehicle number. In some of the states there is a 108. In some of the states there is some 102. So like that, based on the state protocol, there is a number is allotted for the emergency. You can call, and after call, immediately you start the CPR. Nothing but this is cardiac compressions, chest compressions. So this is exact location, this is exact the position of the compressions. Let me tell how you need to give the chest compressions. My dear students, this is the human body. So this is called as thoracic cavity, and this is called as abdominal cavity. Where the thoracic cavity is there, you know, every person is having the bone which is located in between the ribs is called as sternum. So from here to here we can call as sternum. It is one of the hardest bone. So make a sternum as a middle of the place. You know that where the location of the heart. As I told you, the heart is located at the mediasternum. Don't think that the heart is present left side. The heart is always present at the middle of the sternum. Of course, this little bit there is a part is located at the left side. That's what we used to study, the heart is present left side. But exact position of the heart is mediasternum. This is actually. There is a breastbone. So there is a breastbone is there. This is the, you must draw like this on the breastbone, and you must draw like this, and point place is exact location for giving the CPR. If you are giving on here, then only the CPR will be worked out. Then only you are going to give the external massage, external compressions to the heart. The blood supply will be start externally. So this is exact location. And how to place your these hands. So this is called as heel. So this is the place where there is place is there, this you must place over middle point of the chest, place here, and left hand, whatever hand, so dominant hand must be placed first of all, and second hand you must place over here, is it? So next one is, so place over here and place next hand here and go for interconnection. So this is called as interconnection method. And while you're going to place your hands on chest, the hand must be in the straight. If you're giving like this, waist. So you must be straight. So see the position, that is the position is very important if you want to give the CPR. So this is the position, your hands must be straight. So this is the interlock method, interfinger lock method. Make it as a method like this, and whatever your pressure is there, give on it and start the CPR. And I will tell how to give the CPR. Yes. So chest compressions. So this is the way you must give. Place the heel of the one hand in center of the chest. As I told you, place the heel on chest center. Place the other hand on top. Yes. And next, interlock the fingers. Finger you must interlock and start the compressions. How the compressions will be? So compressions will be the rate of the compression. 100 compressions you want to give for 1 minute. 1 minute in the sense 60 seconds. Within 60 seconds, 100 times you want to give the compressions. You must think it is one of the golden procedure to save the life. So within the short of the time, within the 60 seconds, how possible? Don't think it is a possible. You're going to save the life. So you must give as much as fast CPR, and make sure that when you're going to give the compressions, count it 1, 2, 3, 4, 5, like that. You must count up to 30 compressions. Is it? So 30 compressions you give and go for 2 breathing. That I will explain. So give the 30 compressions. While you are giving compression, the chest elevation, the chest depth must be 4 to 5 centimeters. In the sense, for suppose when the giving this compression, the chest movement will be go inside depth up to 4 to 5 centimeters of the depth. You think that much forcefully you want to give. If you are giving superficially, it is a waste of time. The patient will go for that. That's what. Give effectively with pressure and give the depth of the 4 to 5 centimeters. Is it? And next go for relaxation, and next you can go for 2 breathings. So give the 30 compressions, give the break in the sense not more than seconds. So give the 30 compressions and give the breathing. Again you start the 30 compressions and give the breathing. That breathing pattern, how you need to give, that I am going to explain. Yeah. So this is the way. So this is the position of this head chin tilt method. Make sure that before you are giving to mouth respiration, I want to tell. So in the first session, in the orientation session, I said you safety is the very important. The top priority, safety for the patient. The second priority, the safety for you also. Why I am telling here? He is an unknown person, fall down, and he is a person you don't know. If you are giving directly the mouth to mouth respiration, don't know the patient is might be the somewhat deceased. Don't know the patient is somewhat communicable deceased. In such a case, if you are giving mouth to mouth respiration, you may get the same disease condition for you also. So what I am trying to tell, prefer mostly mouth to nose respiration. The same position, and try to push your air to the nose. And when you are giving respiration, see the chest compression. If when you are giving respiration forcefully, definitely the chest will be expand and it will be recoil. Like the 2 breath you can give. So once your breathing 2 is completed, again you start your CPR, 30 compressions. So here the continuing of the CPR you can give 30 compressions, then you can go for 2 breath. Again you start CPR 30 compressions, again you can go for breathing. So what I am trying to say, until getting of the patient response, we will try until giving this advanced thing 104 or 108, whatever the things will come. Until we are going for hospital, you try to give maximum support, then the patient will, by God grace, he will come back. So if he is not, then you can go for defibrillation. The defibrillation I will explain in some other section. So by that, my dear students, so today I have explained regarding CPR procedure. It is one of the golden procedure and you must give in the golden time. When you are giving the golden time, it will be called as the golden procedure. And you are the person is going to save the life of the peoples. That's what the medical professional peoples or unmedical, whoever, as a human, everyone must be know what is the meaning of CPR in order to save the life at the some situations. Dear students, so this is the today topic. I am going to conclude it with CPR definition, purpose, and what is the steps. In detail I explained. I hope you understood. So tomorrow I will come with new topics. So I hope this kind of the videos is going to helpful for you. Those who are in the supply, those who are going to attend the regular exams, not only GNM, not only B.Sc, every level of education, these are the videos is going to helpful for you. So dear students, please follow our channel, please like and please subscribe our channel. By that you will face and you will get everything from our Gitanjali Group of Institutions. And we are here to explore the knowledge of all the nursing students. I hope you understood today's session. We'll meet for next session. Until that, stay tuned. Thank you so much.